health and a little wealth and a lot of love.
So explain to us, what is a pill burden?
So when we talk about pill burden, so that's a way that we talk about the amount of medications, specifically the amount of chronic medications that the average American takes on a daily basis. So not just the occasional as needed medication, which, I mean, that can be part of it as well, but the medications that we take on a consistent day to treat our chronic conditions, our symptoms, our medical problems.
In other words, we have to take these, or we die.
And not necessarily die, but definitely contributes to symptoms. So sometimes we take medications for symptoms. Sometimes we take medications to better manage our chronic conditions. Sometimes it decreases our risk of certain things like heart disease. Sometimes it helps us to manage our blood sugars, our blood pressure, and sometimes it's for pain control, treatment of cancer. So there can be a lot of different reasons why people take these medications.
Gotcha. And when we say polypharmacy, that's just multiple medicine, multiple prescriptions, right?
Yeah, there are a lot of different definitions. So polypharmacy, in the simplest sense of the term, would be taking multiple medications. But there are different definitions. Some people believe polypharmacy is 5 or more medications. Another definition would be taking an excess, so taking more medications than are actually needed. So I think in this country, a lot of people feel that we overprescribe, that we're over-treating symptoms, and we are risking potential side effects and other problems by just adding another medication to the list without really thinking about it and evaluating first.
Gotcha. So you say others think. What do you think? I mean, you're on the front lines. You worked directly. I feel like traditional medicine, this is why we're doing this podcast. We're trying to move away from traditional medicine, which is overprescribed. Like, what do you think about that? Do you agree that overprescription is a thing? And are you incentivized? Like, what's behind the curtain? Would you tell folks that are listening around prescriptions and how to be wary of some of that?
I think polypharmacy is a big problem that we do truly need to address, especially in older populations, in our elderly population, our elderly patients, that something that people don't really consider. And a lot of doctors will consider this, but when you get older, your organs aren't functioning as well to be able to metabolize these medications. So your kidneys and your liver, they're the two main organs that will break down the medications or, and toxins or other substances in your system, but they're not working as efficiently. So medications are just more prone to building up at higher levels when you're older in age, because your kidneys just aren't getting rid of it as quickly as they would when you're younger, when everything's working the way it should be.
Got it.
With a little health and a little wealth and a lot of love, that's a life that we live. Susan Scruggs.